Tell me about yourself.
Good morning, and thank you for giving me this opportunity. My name is Mihiraa. I recently completed my nursing education and am excited to begin my career as a registered nurse. Before studying nursing, I worked as an operation theater technician. That experience helped me understand the importance of patient safety, teamwork, and infection prevention. It also inspired me to become a nurse because I wanted to have a greater role in caring for patients and supporting them throughout their recovery. During my clinical placements, I cared for patients in different hospital settings. I assisted with patient assessments, medication administration under supervision, wound care, documentation, and health education. I always treated patients with respect and compassion. I enjoyed listening to their concerns and making them feel comfortable during stressful times. I describe myself as calm, caring, and eager to learn. I communicate well with patients and colleagues, and I am comfortable asking questions when I need guidance. I believe patient safety, dignity, and teamwork are the foundation of good nursing care. As a new graduate, I know there is still much to learn. I am open to feedback and committed to continuous professional development. I am looking for an organization where I can grow, contribute to the team, and provide safe, high-quality, patient-centered care. I would be proud to begin my nursing career with your hospital.
Why did you choose nursing as a profession?
I chose nursing because I wanted a career where I could make a real difference in people's lives. I enjoy helping others, especially when they are going through difficult times. Nursing allows me to combine compassion with clinical skills to improve a patient's health and well-being. I believe even small acts of kindness, such as listening carefully or providing comfort, can have a positive impact on a patient's recovery. Before studying nursing, I was interested in healthcare and wanted a role that involved direct patient care. During my nursing education and clinical placements, I saw how nurses support patients and families every day. They not only provide treatments but also educate, encourage, and advocate for their patients. Watching experienced nurses work with confidence, empathy, and professionalism strengthened my decision to become a nurse. My clinical placements confirmed that I had chosen the right profession. I enjoyed communicating with patients, working as part of a multidisciplinary team, and learning new clinical skills. Every placement taught me something valuable and increased my confidence. I know nursing can be challenging, both physically and emotionally, but I see those challenges as opportunities to grow. As a new graduate nurse, I am excited to continue learning, develop my skills, and provide safe, compassionate, and patient-centered care throughout my career.
What do you know about our hospital, and why do you want to work here?
Before applying, I took time to learn about your hospital through your website and recent information available online. I was impressed by your commitment to providing safe, high-quality, and patient-centered care. I also noticed that your hospital values teamwork, respect, continuous learning, and professional excellence. Those values match the kind of nurse I want to become. I understand that your hospital provides care to patients with different medical needs and encourages staff to continue developing their knowledge and skills. I was pleased to see that new graduate nurses receive support through orientation, mentorship, and ongoing education. As someone who is starting my nursing career, I believe learning from experienced nurses in a supportive environment is very important. I want to work here because I am looking for a hospital where I can build a strong clinical foundation while providing compassionate care to patients. During my clinical placements, I learned the importance of communication, teamwork, and patient safety. I would like to continue developing those skills in an organization that encourages professional growth and evidence-based practice. I know I am a new graduate, but I am motivated, willing to learn, and open to feedback. I believe I can contribute with a positive attitude, a strong work ethic, and a genuine commitment to delivering safe, respectful, and patient-centered nursing care. I would be proud to begin my nursing career with your team.
What are your short-term, 6 months, and long-term, 5 years, career goals?
My short-term goal is to become a safe, confident, and competent registered nurse. During my first 6 months, I want to build a strong foundation in clinical practice. I hope to improve my assessment skills, clinical decision-making, time management, and communication with patients and a multidisciplinary team. I also want to become familiar with the hospital's policies, documentation systems, and clinical guidelines. I know I am a new graduate, so I will ask questions, accept feedback, and learn from experienced nurses. My priority is to provide safe, compassionate, and patient-centered care every day. My long-term goal over the next 5 years is to become an experienced and reliable nurse who can manage complex patient care with confidence. I would like to continue my professional development by attending training programs, completing continuing education, and keeping my knowledge up to date through evidence-based practice. I also hope to develop leadership skills by mentoring future new graduate nurses and contributing positively to my team. If the opportunity arises, I would like to pursue a postgraduate qualification in an area that interests me. My overall goal is to continue growing as a nurse, improve patient outcomes, and make a meaningful contribution to the organization throughout my career.
What are your greatest strengths and weaknesses?
One of my greatest strengths is that I am eager to learn. As a new graduate nurse, I understand that every day is an opportunity to improve my knowledge and skills. I welcome feedback from senior nurses because I believe it helps me become a better and safer practitioner. Another strength is my ability to stay calm under pressure. During my clinical placements, I learned to remain focused, prioritize patient needs, and communicate clearly with the healthcare team, even during busy shifts. I am also compassionate and a good listener. I take time to understand my patients' concerns and treat them with respect, dignity, and empathy. I believe these qualities help build trust and improve the patient experience. One weakness I have noticed is that, as a new graduate, I sometimes lack confidence when performing unfamiliar procedures for the first time. However, I see this as an opportunity to learn rather than a limitation. I prepare by reviewing clinical guidelines, observing experienced nurses, asking questions when I am unsure, and practicing under appropriate supervision until I become competent. This approach has helped me gain confidence while maintaining patient safety. I know I still have a lot to learn, but I am committed to continuous improvement, and I am confident that my willingness to learn and positive attitude will help me grow into a skilled and dependable registered nurse.
Tell me about the most challenging patient you cared for during your clinical rotations.
One of the most challenging patients I cared for during my clinical placement was an elderly patient who had a stroke. The patient had difficulty speaking and moving one side of the body. They became frustrated because they could not express their needs clearly and were sometimes unwilling to participate in rehabilitation. My responsibility was to support the registered nurse in providing daily care while helping the patient feel comfortable and respected. The biggest challenge was communicating effectively and reducing the patient's anxiety. I remained patient and gave the patient enough time to respond without rushing. I used simple language, maintained eye contact, and paid attention to nonverbal cues. I also involved the family whenever appropriate because they understood the patient's usual way of communicating. I encouraged the patient during rehabilitation sessions and praised every small improvement. I worked closely with the registered nurse and other members of the multidisciplinary team to ensure the care plan was followed consistently. Over time, the patient became more cooperative and showed greater confidence during therapy. This experience taught me that good nursing is not only about clinical skills but also about patience, empathy, and effective communication. It reinforced the importance of treating every patient with dignity and providing care that meets their individual needs.
Describe a time you had a conflict with a coworker or team member. How did you resolve it?
During one of my clinical placements, I was working with another student nurse during a busy morning shift. We misunderstood who was responsible for preparing a patient for a scheduled procedure. As a result, there was a delay in completing the preparation. Although the patient was not harmed, we both felt frustrated by the situation. Instead of blaming each other, I suggested that we discuss what had happened after the patient was cared for. We realized the problem was not a lack of teamwork but a communication gap. We agreed that, before starting each shift, we would clearly divide our responsibilities and confirm our understanding with each other. We also updated our supervising registered nurse so that everyone knew the plan. After making these changes, we worked together much more effectively for the rest of the placement. Our communication improved, and tasks were completed on time without confusion. This experience taught me that conflicts are often caused by misunderstandings rather than personal differences. I learned the importance of addressing issues respectfully, listening to the other person's perspective, and focusing on finding a solution. As a new graduate nurse, I believe open communication, mutual respect, and teamwork are essential for providing safe and high-quality patient care.
Tell me about a time you had to work under significant pressure or handle a high-stress situation.
During one of my final clinical placements, I experienced a very busy morning shift in the medical ward. Several patients required care at the same time. One patient suddenly developed shortness of breath and low oxygen saturation, while another patient needed medication, and a newly admitted patient required an initial assessment. As a student nurse, I knew I had to remain calm and work within my scope of practice. My first priority was patient safety. I immediately informed my supervising registered nurse about the patient with breathing difficulty. Under her guidance, I assisted with monitoring the patient's vital signs, applied oxygen as prescribed, and prepared the necessary equipment. At the same time, I communicated with the rest of the team so that other patients continued to receive timely care. I stayed focused, followed instructions carefully, and completed my delegated responsibilities without rushing. The patient's condition stabilized after prompt treatment, and the rest of the team's coordinated efforts ensured that all patients received appropriate care. At the end of the shift, my supervising nurse thanked me for staying calm, communicating clearly, and prioritizing tasks effectively. This experience taught me that working under pressure requires good communication, teamwork, and the ability to prioritize patient needs. As a new graduate nurse, I know busy situations are part of nursing, and I am committed to remaining calm, asking for support when needed, and always keeping patient safety as my highest priority.
Describe a time you witnessed something unethical or a colleague making an error. What did you do?
During one of my clinical placements, I noticed that a student nurse was about to record a patient's blood pressure in the wrong patient's chart because two patients had similar names. The documentation had not been completed yet, and I realized that this could lead to incorrect clinical decisions if it was not corrected immediately. As a student nurse, I knew my responsibility was to protect patient safety while remaining respectful to my colleague. I politely spoke to the student in a quiet and professional manner and asked if we could verify the patient's identity together. We checked the patient's name, date of birth, and identification band. We quickly recognized the mistake before the information was entered into the medical record. I then informed our supervising registered nurse about what had happened so that she was aware of the situation and could provide guidance. The supervising nurse appreciated that we identified the error early and handled it appropriately. No incorrect documentation was made, and no harm came to the patient. The incident also reminded the whole team of the importance of following patient identification procedures every time. This experience taught me that everyone can make mistakes, especially while learning. What matters most is speaking up respectfully, following hospital policies, and taking prompt action to protect patient safety. I believe nurses have a professional and ethical responsibility to address concerns and support a culture of safety and open communication.
Tell me about a time you went above and beyond for a patient.
During one of my clinical placements, I cared for an elderly patient who had been admitted for several days. The patient was physically stable but seemed withdrawn and anxious. They rarely spoke and often refused meals. While assisting with routine care, I noticed that the patient seemed lonely and worried because their family lived far away and could not visit often. Although I had other responsibilities, I made sure to spend a few extra minutes with the patient whenever my tasks were completed. I listened to their concerns, encouraged them to express their feelings, and reassured them that they were not alone. I also informed my supervising registered nurse about the patient's emotional state so that it could be included in the care plan. With the nurse's guidance, I encouraged regular communication with the family through phone calls and continued to provide emotional support during my shifts. Over the next few days, the patient became more engaged in conversations, started eating better, and participated more willingly in their care. Before I completed my placement, the patient thanked me for taking the time to listen and making them feel valued. This experience taught me that going above and beyond does not always mean doing something extraordinary. Sometimes, giving a patient your time, attention, and compassion can make a meaningful difference. It reinforced my belief that nursing is about caring for the whole person, not just treating their medical condition.
Describe a time you received constructive feedback on your clinical practice. How did you implement it?
During one of my medical ward placements, my supervising registered nurse gave me constructive feedback about my patient handover. She told me that although my information was accurate, I was including too many unnecessary details. This made the handover longer than needed and could make it harder for the next nurse to identify the most important clinical information. I appreciated the feedback because I wanted to improve my communication skills. I asked my supervisor for advice on how to make my handovers clearer and more structured. She introduced me to the ISBAR communication framework and demonstrated how to present information in a logical and concise way. I reviewed the patient's notes before each handover, identified the key points, and practiced using the ISBAR format whenever I handed over a patient. I also asked for feedback after each shift so I could continue improving. Within a short time, my handovers became more organized, confident, and efficient. My supervising nurse commented that I was communicating more clearly and prioritizing important clinical information effectively. I also noticed that the healthcare team understood my handovers more easily and asked fewer clarification questions. This experience taught me that constructive feedback is an important part of professional growth. As a new graduate nurse, I welcome feedback because it helps me improve my practice, strengthen my communication skills, and provide safer, higher quality patient care.
Tell me about a time you had to advocate for a patient's needs.
During one of my clinical placements, I was caring for a postoperative patient who appeared to be in significant pain. The patient had become quiet and was reluctant to move because of the discomfort. Although the patient had not asked for help, I noticed changes in their facial expression and body language during my assessment. As a student nurse, I knew it was important to advocate for the patient's needs while working within my scope of practice. I performed a pain assessment using the appropriate pain scale and reported my findings promptly to my supervising registered nurse. I explained that the patient's pain seemed to be limiting their movement and recovery. Together, we reviewed the patient's medication chart and the nurse administered the prescribed pain relief. I continued to monitor the patient's comfort level and encouraged them to let us know if their pain increased again. I also reassured the patient that effective pain management was an important part of their recovery. After receiving pain relief, the patient reported feeling much more comfortable and was able to participate in deep breathing exercises and mobilization with assistance. Their overall mood also improved. This experience showed me that patient advocacy begins with careful observation, active listening, and timely communication. As a new graduate nurse, I will always speak up for my patients' needs, collaborate with the healthcare team, and ensure that patients receive safe, compassionate, and appropriate care.
How do you handle patients with different cultural or religious beliefs?
I believe every patient deserves to be treated with dignity, respect, and compassion, regardless of their cultural or religious beliefs. As a nurse, it is my responsibility to provide patient-centered care that respects each person's values, preferences, and traditions. During my clinical placements, I cared for patients from different cultural backgrounds. I learned that it is important not to make assumptions. Instead, I respectfully ask patients about any cultural, religious, or personal preferences that may affect their care. For example, some patients may have dietary restrictions, prefer a same-gender healthcare provider, or need time for prayer. If these requests can be accommodated safely, I will work with the healthcare team to support them. I also understand the importance of clear communication. If there is a language barrier, I would use a professional interpreter according to hospital policy rather than relying on family members. This helps ensure the patient understands their treatment and can make informed decisions about their care. If I am unfamiliar with a patient's cultural or religious practice, I am not afraid to ask respectful questions or seek guidance from senior nurses. I see this as an opportunity to learn and provide better care. As a new graduate nurse, I will always treat every patient as an individual. By listening carefully, respecting their beliefs, and communicating openly, I can build trust and provide safe, compassionate, and culturally sensitive nursing care.
Walk me through your process for prioritizing patient care tasks when you have a busy shift.
When I have a busy shift, my first priority is always patient safety. I begin by receiving a clear handover and reviewing each patient's condition, care plan, and any urgent tasks. I identify patients who are unstable or at higher risk, such as those with abnormal vital signs, breathing difficulties, severe pain, or a risk of deterioration. These patients receive my immediate attention. Next, I prioritize time-sensitive tasks, such as medications, assessments, and treatments. I also consider which tasks can be grouped together to work more efficiently without compromising the quality of care. Throughout the shift, I continue to reassess my priorities because a patient's condition can change at any time. As a new graduate nurse, I understand that I cannot manage everything alone. If I feel overwhelmed or if a patient's condition changes, I will communicate promptly with the registered nurse and ask for guidance or assistance. I believe good teamwork and clear communication are essential during busy shifts. I also make sure to document my care accurately and hand over important information to the next shift. Even when the ward is busy, I try to remain calm, organized, and focused. I avoid rushing because rushing can increase the risk of mistakes. My approach is to stay flexible, communicate effectively, and continually reassess priorities so that every patient receives safe, timely, and compassionate care.
If you noticed a patient's condition suddenly deteriorating, what is the first thing you would do?
If I noticed that a patient's condition was suddenly deteriorating, my first priority would be to ensure the patient's safety and perform a rapid assessment using the ABCDE approach. I would assess the patient's airway, breathing, circulation, disability, and exposure to identify any immediate life-threatening problems while staying with the patient. At the same time, I would call for help immediately and notify the registered nurse or activate the hospital's rapid response or emergency team according to hospital policy. As a new graduate nurse, I understand the importance of recognizing my limits and escalating concerns without delay. Early escalation can prevent further deterioration and improve patient outcomes. While waiting for assistance, I would continue monitoring the patient's vital signs, provide appropriate interventions within my scope of practice, such as administering oxygen if indicated and permitted by hospital policy, and prepare any emergency equipment that may be needed. I would also reassure the patient, explain what was happening if they were conscious, and communicate clearly with the healthcare team using the ISBAR framework. Once the situation was under control, I would document the events accurately and participate in the handover and any debriefing if required. This approach helps ensure patient safety, effective teamwork, and continuity of care. My focus would always be on recognizing deterioration early, acting quickly, and seeking help without hesitation.
How do you ensure accuracy when documenting patient information or administering medications?
I understand that accurate documentation and safe medication administration are essential responsibilities of a nurse because they have a direct impact on patient safety. Even as a new graduate nurse, I know that attention to detail is very important. When documenting patient information, I make sure my documentation is accurate, clear, objective, and complete it as soon as possible after providing care. I record only factual observations, avoid assumptions, and follow the hospital's documentation policies. Before entering any information, I verify that I am documenting the correct patient's record. If I notice an error, I follow the correct procedure to amend it rather than trying to hide or delete it. When administering medications, I always follow the medication safety principles, including the 5 rights: the right patient, right medication, right dose, right route, and right time. I also check the patient's identity using at least 2 identifiers, review the medication chart carefully, check for allergies, and confirm any unclear orders with the registered nurse or prescribing doctor before proceeding. If I am ever unsure about a medication, I stop and ask for guidance instead of making assumptions. I believe it is always better to take an extra moment to verify information than to risk a medication or documentation error. My priority is to provide safe, accurate, and high-quality care while maintaining patient trust and professional accountability.
What would you do if you were asked to perform a task you haven't been trained to do yet?
If I were asked to perform a task that I had not been trained or assessed as competent to do, I would be honest about my level of experience and would not perform the task independently. Patient safety would always be my first priority. I would explain respectfully that I am not yet competent to carry out the procedure on my own. I would then ask the registered nurse or an experienced colleague for guidance or supervision. If appropriate, I would observe the procedure, ask questions, and perform it under direct supervision if I was permitted to do so. This would help me learn the correct technique while ensuring the patient receives safe care. During my clinical placements, I learned that asking for help is a sign of professionalism, not weakness. There were times when I was unfamiliar with certain procedures, and I always sought guidance from my supervising nurse. With support and practice, I gradually became more confident and competent while working within my scope of practice. As a new graduate nurse, I know there will be many opportunities to learn new skills. However, I also understand the importance of recognizing my limitations and following hospital policies. I would never guess or perform a procedure that could put a patient at risk. My approach is to communicate openly, seek supervision, and continue learning so that I can safely expand my knowledge and skills throughout my nursing career.
How would you respond if a family member was unhappy with the care being provided?
If a family member was unhappy with the care being provided, I would remain calm, professional, and respectful. I understand that family members are often worried or stressed because someone they care about is unwell. My first step would be to listen carefully without interrupting and allow them to explain their concerns. I would acknowledge their feelings and thank them for bringing the issue to my attention. I would then ask questions to understand the situation clearly and explain what I know within my role while maintaining the patient's privacy and confidentiality. If the concern was something I could address immediately, such as improving communication or meeting a comfort need, I would do so promptly. If the issue involved medical decisions or was beyond my scope of practice, I would inform the registered nurse or the appropriate member of the healthcare team without delay. During one of my clinical placements, a patient's family was worried because they felt they were not receiving enough updates about the patient's condition. I listened to their concerns and informed my supervising registered nurse. She spoke with the family, answered their questions, and explained the treatment plan. The family felt reassured and appreciated being kept informed. This experience taught me that listening with empathy, communicating honestly, and escalating concerns appropriately can build trust and help resolve problems while keeping the patient's best interests at the center of care.
How do you maintain your own physical and mental well-being to avoid burnout?
I believe that looking after my own physical and mental well-being is important because it helps me provide safe and compassionate care to my patients. Nursing can be physically and emotionally demanding, so maintaining a healthy balance is essential. I try to take care of my physical health by getting enough sleep, eating balanced meals, staying hydrated, and exercising regularly. Even simple activities like walking help me stay active and reduce stress. I also make sure to take my scheduled breaks during shifts whenever possible because I know that staying rested helps me remain focused and reduces the risk of errors. To support my mental well-being, I make time for activities I enjoy, such as spending time with my family and friends, listening to music, and relaxing after work. If I have a difficult shift, I reflect on what I learned and talk to a trusted colleague, mentor, or supervisor when I need support. I believe it is important to ask for help rather than trying to manage everything alone. As a new graduate nurse, I know the transition into practice can be challenging. I plan to continue learning, seek guidance from experienced nurses, and maintain a healthy work-life balance. By taking care of myself, I can stay resilient, continue developing professionally, and provide safe, compassionate, and high-quality care to my patients.